I mean, I'm not saying there's not genetic roles, but I feel like traction alopecia. What's your viewpoint? I saw a research paper talking about the way that we are caring for our hair is causing a lot of our traction alopecia. I remember I lost a lot of my hair um, about 4 years ago in the middle, and it was and it was due to so my dermatologist, which was a Black female. Yeah, shout out to another one. But anyway, she did a biopsy, and she was like, yeah, there's some inflammatory cells. So there's different types of alopecia. So guys, for those of you who know what alopecia means you're losing your hair, and your hair follicles are dying for some kind of reason. Sometimes it's genetic, right? Especially for males. It comes through your mother's line. And sometimes your white blood cells literally eat your follicles. It's an inflammation or some kind of inflammatory allergic response. And sometimes it's literally a physical damage to the area. And I just stopped perming my hair. When I found out that, it was happening, I stopped permanent my hair. And like my hairdresser at the time was like, oh, it's in your genetics. I'm like, no, because my mother was doing the same improper treatments to her hair, braiding, jerry curl, perming, tight braiding. And I said, you know what, I'm not going to do it anymore. And I have a full head of hair. It all grew back. You know what I'm saying? So it wasn't genetic, because as soon as I stopped my behavior, the hair came back. And I'm wondering if, I want your opinion. I'm feeling that, the weaving and the braiding and the really, really tight braiding and the pulling and the chemicals that we're putting in our hair may be causing alopecia that we wouldn't have if we didn't do those things. I saw they have all these videos of remaking people on TV, on Facebook, and this woman who has this massive bald spot, and then they weaved her hair and they're like, oh, it looks so nice. And I'm like, well, what caused the massive amounts of alopecia? I don't know. What's your take on it?
Yeah. So yeah, it is a major issue. It's a major issue, especially in Black women. So I'm glad that you definitely define that, because a lot of times I have patients who come and say, oh, I'm coming in, I have this hair loss, and my hairdresser said I might have alopecia, but I know I don't have alopecia. Do I have alopecia? Alopecia is just a general medical term
for hair loss. That's what
medical term. So,
they think they have a disease, like they think.
Right. So,
which it is a disease. Yeah, but
you have to kind of drill down and see what's causing it, because there are many different types of alopecia. But if you have hair loss, you have alopecia.
Right.
So we generally divide alopecia into scarring and non-scarring alopecia.
Right.
Okay? So non-scarring is going to be like your male pattern hair loss, your female pattern hair loss. That's what you're kind of referring to as far as to your genetics. You can have general thinning. We call that telogen effluvium. That can be like stress-induced, medication-induced after surgery.
Right.
Sometimes after people have a
baby, the hair.
Shedding. Okay, but that's non-scarring. It usually resolves. And then traction alopecia, interestingly enough, can be non-scarring. Okay, if it's early, yeah, it can be reversible. Okay, it's when it's late it crosses over to the other category of scarring alopecias. Okay, and so scarring alopecias are where there has been so much inflammation at that level of the hair follicle that it has caused that hair follicle to scar. And so if you've ever had a scar, if you've ever had a cut, does the hair regrow in that area where the scar was?
No.
Never regrows once it's scarred. Yeah. So, that's one thing about traction alopecia, is that if you can get it early, it can be reversible. Once it's been present for years, it's usually irreversible unless unless transplantation occurs.
Right.
The other very, very common form of scarring alopecia in African American women is Ccca. You might have heard of that, central centrifugal cicatricial alopecia.
That's the one that like circles the crown, right? Yeah. Yeah.
So central, then right here in the crown area. Centrifugal means that it usually expands. Cicatricial means scarring. Okay, and then that alopecia. That is probably even more common than traction. They're kind of neck and neck, but that's one where we're learning a little bit more about the causes of it. So you're asking, traction alopecia versus Ccca, which I'll just kind of talk about those because they're the two most common cause of hair loss in African American women. Traction alopecia is strictly due to hairstyling practices. Okay, 100%. Traction alopecia is not a genetic thing. The study that you might have been referring to came out of, I think it was Johns Hopkins.
Yes, it was. Yep.
Yeah, it was about 3 years ago, I think, where they had done a study, and they basically looked at and kind of categorized high-risk hairstyles, medium-risk hairstyles, and low-risk hairstyles. Okay, so your low-risk hairstyles are going to be natural, loose, nothing tying it back. Loose ponytails probably fall into that category as well. Moderate risk hairstyles are going to be natural hair that you either braid, do sew-in weaves, anything that's pulling tension. Exactly, on natural hair is still considered a moderate risk hairstyle. Does that mean that necessarily you should never do moderate risk hairstyles? No. Okay, but it means in moderation.
Moderation, absolutely.
Yeah. So the recommendations of that study was, don't leave in, braids longer than 2 to 3 months. I generally tend to lean more towards the 2 months. 3 months is a little long for me, but I'm just saying what that article said.
Yeah, I'm going to my braid lady in December, like, because it's good to rest the hair. You know what I'm saying?
Do larger diameter braids. So
right.
When you're doing a lot of the mini braids, that's excess hair and excess weight on the hair. And so the moderate risk are kind of that. One other thing was dread. Well, I don't like to call them dreads. I know sometimes people call them
locks.
Yes. So locks can be a moderate risk hairstyle also. Usually when they're shorter, they're not as dangerous, but as they get longer and heavier, that length and that weight of that hair pulls, and people get a lot of traction alopecia in that crown area. And then high risk hairstyles are going to be when you're doing all of what I just mentioned. You're doing braids, you're doing sew-ins, but you're doing it on a relaxed hair. Okay?
Right.
So relaxed hair is already in a very weakened state, and then you're putting tension on top of that. There's no way you can win with that. Okay, so if you are going to be relaxed, then you need to do, try to do as low risk as you can, meaning keep your hair loose, keep things off of it. I probably would not routinely recommend to do braids or sew-ins if you have relaxed hair. If you have, if you have natural hair. And also with relaxed hair, you need to keep heat off of it. Okay.
Keep what off? Keep what?
Heat.
Right. But the thing is, what they do is they relax your hair, and on top of that, they flat blow dry it, and then they flat iron it. And some of us are doing that every 6 weeks. You know?
Do it every week. Well,
no. The perming. Yes. And with me, man, if my friends remember, they must have died and gone to heaven. I don't believe in dying and going to heaven, but you get my point. That when they saw that I went natural, because I was very much relaxed, and I would every week flat iron, curling iron my hair. Yeah, I would put heat on my hair plus relaxer, plus braids. Yeah, I know why. And this awareness is what can stop people early from getting, you know, the traction alopecia turning into scarring. Yeah.
Absolutely. So you know, that's why that's important. That's where the hairstyles really come into play as far as you know. And again, a lot of times people think just kind of frontal hairline, but traction can occur anywhere, you know, throughout the scalp. You know, exactly what you said. You know, the crown area, it can be, you know, the occipital scalp, which is towards the back. And then the other thing is with our children also, you know, not styling their hair, pulling their hair too tight. I get it all the time where parents will say, oh, my daughter's hair is not too tight. If you see little bumps on the scalp, little papules around the hair follicles, even if the child is not complaining, it's too tight.
It's too tight.
It's too tight. And studies have shown that recurrent tight hairstyles can affect your hair up to 10 years after you stop it.
Wow.
So sometimes people say, oh, I don't do that anymore. I did it when I was a teenager, but now I have all this hair loss. Well, that's because you still did it.
Yeah.
It was just a while back.
Yeah. Yeah. Like even, you know, the curl pattern, like my hair was growing straight for a while because I feel like it was just the way over time. You know, many of us, including myself, had our hair straightened from I was 8 years old. So 8 years old to what, 30, maybe 36. I have been doing this, you know? Yeah. And it's not just me. And the knowledge of this is so crucial. But, you know, I didn't get this information until I got a biopsy from my dermatologist.
Yeah, absolutely. And that's also very important because, you know, you can try to, you know, treat things at home, but it is also important to get a correct diagnosis.
Right.
Because a lot